Good morning, everyone. And for those who are watching, I am Terence Andrew Vicenteno. And this is Ernest Jan Pasion from BSN 2-8. And currently, we are here to discuss the National Tuberculosis Program, or other people called National Tuberculosis Control Program by the DOH. So let us start. So what is National Tuberculosis Control Program? So the National Tuberculosis Control Program was organized way back 1978, and it is operating within the devolved healthcare delivery system, and it is one of the public programs managed and coordinated by the Infectious Disease for Prevention and Control Division, or other people called IDPCD, or of the Disease Prevention Control Bureau, DPCD, of the Department of Health, which our government mandate. So, the National Tuberculosis Control Program aims to promote health and quality of life by preventing, controlling, and eventually eliminating tuberculosis by collaborating with other countries and international partners in controlling the global tuberculosis. So currently, in the Philippines, there are 340,528 cases of tuberculosis, but our government is doing something by building programs that can fight it. So currently, there are 3,632 tuberculosis treatment facilities, which helps to cure the problem. And there are also 3,695 tuberculosis laboratories. So for the next one. So to provide you some information for what is tuberculosis is, tuberculosis is an illness caused by bacteria that are spread from one person to another through the air. TB is typically damages the lungs, but it might have an impact on other areas of the body, such as the brain, either the spine or the kidney. An individual without treatment, people with TB risk dying receive medical attention. So, yung TB po is sobrang tagal na nagde-develop sa body natin ang hindi natin napapansin. There are some parts of the body na naapektuhan nito. So, akala minsan natin na it is a normal na ubo, normal na sakit, paninikip ng dibdib. But, with us out knowing na isa na pala itong malubhang sakit na pwedeng makahawa sa ibang tao. And also, when it comes to this problem, our community needs to be involved. We need to communicate through the national government agencies. We need to be included the public and private sectors, non-governmental organization. We need to communicate and provide information to professional societies, academe, patient groups, civil societies, and development partners in the Philippines to fight against tuberculosis, especially at this time of the COVID-19. So, TB is caused by the Mycobacterium tuberculosis, which is a species of pathogenic bacteria in the family of Mycobacterius and causative agent of tuberculosis. And tuberculosis is first discovered way back in 1882 by Robert Koch. So, how does tuberculosis spreads? The bacteria spread through the air from one person to another. So, airborne po ito, napapasok to sa hangin. So, mas malaki yung possibility na mas kumalat or maipasa yung tuberculosis when it comes to closed areas. For example, in a room, sa mall, compared to the open areas, it is like a COVID-19 po na madaling maibigay from one person to another. When a person with tuberculosis disease of the lungs or throat coughs, speaks, or sings, tuberculosis bacteria can get into the air. People nearby may breathe in this bacteria and become infected. So, ang pinaka-passageway ng tuberculosis is pwedeng pumasok ito sa bibig natin and sa ilong since it is airborne. pwede natin siya ma-inhale and may mga common mistakes yung mga tao na pag may tuberculosis ka is madali mo silang mahahawa. Like pag lumapit ka sa kanila na pwede mo silang mahawa. So when we communicate with people with tuberculosis, we just need to cover our mouth, our nose, or wear some face mask. And tuberculosis is not spread by shaking someone's hand kasi wala naman siyang included na air. So, sharing of food or drinks, touching bed linens or toilet seats, sharing toothbrushes, and kissing. So, these samples are the common mistakes na iniisip ng mga tao na maging way para mahawa yung mga ibang tao sa tuberculosis. People with tuberculosis are most likely to spread it to people they spend with every day. This includes family members, friends, and co-workers or schoolmates, which means within our community. Kasi lagi natin silang kasama. So, sobrang laki ng possibility. Based on the research, there are 78% na mahawa yung family members mo sa tuberculosis. So, paano nga ba natin matetest if you are positive for tuberculosis? These are the types of tests for tuberculosis. There are two types of tests for that tuberculosis infection, the TB skin test and the TB blood test. A person health provider should choose which TB test to use. Factors in selecting which test to use include the reason for testing, test availability, and cost. So, when it comes to the reason for testing, so yung mga iba kasing tao is takot sila sa blood, takot sila sa injection, ganun. So, may mga different ways na pwede tayong gawin. Yung test availability, for example, if nasa province or kung ano lang talaga yung pinaka-available sa hospital natin. And for the cost. Kasi yung ibang poor families na galing sa community natin is hindi talaga nila afford kung masyadong mahal yung test na pipiliin nila. So, the tuberculosis skin test is also called the Mantoux tuberculin skin test or TST. With a healthcare provider on the first visit, the test is placed. On the second visit, the healthcare provider did the test. So, ginagawa to, alam naman natin na for the nurse, sa mga nanonood na nurse, alam ko na experience nyo na mag-return demonstration when it comes to skin test. So, it is like a skin test lang po. May inject na substance and chemical sa skin natin. And if mag-react yung body natin doon, it means na we are positive in the bacterium, pero hindi meaning nun na malala na yung tuberculosis natin. So, positive skin test, this means that the person's body was infected with TB bacteria. Yun po yung sinasabi ko. Additional tests are needed to determine if the person has latent TB infection or TB disease. So when it comes naman po sa negative skin test, this means that the person's body did not react to the test and that latent TB infection or TB disease is not likely. There is no problem in repeating a TB skin test. If repeated, the additional test should be placed in a different location of the body. For example, nag-skin test tayo in the left arm natin po. So, pwede natin siyang ulitin if hindi tayo convinced. Kaso, sa other arm naman po. For the next one. Ito po yung sinasabi ko na hindi porket positive ka sa skin test is magkakaroon ka na ng positive TB. So, there are ways to test po talaga if severe na yung tuberculosis. What does a test for tuberculosis infection mean? A positive tuberculosis solely shows that a person has been infected with TB bacteria. It doesn't determine whether the individual has grown into the TB illness. So, ito po yung sinasabi ko kanina. Other tests includes a chest x-ray and a sputum sample is required to test whether they have TB disease. So, sa pinakamagandang way po talaga na matest yung sa tuberculosis is through x-ray and mag-consult po tayo sa mga physician because they already know kung ano yung magiging results and they've been studying it for years. And yung when it's come to sputum naman po, this thick type of mucus made in our lungs. So active tuberculosis is a stage where immediate medication and care is necessary. So these are the common illness. So persistent cough. So when it comes to tuberculosis, akala nila ubo-ubo lang, normal na ubo. Pero nami-mistaken sila na hindi na pala normal na kapag umuubo ka for more than 2 weeks kasi this is a severe symptom na meron ka ng tuberculosis. So, cough with blood in sputum. So, nabanggit ko na po yung sputum is a type of mucus made in our lungs. So, pag nasamahan na po siya ng dugo, it is very alarming for us. Fever for more than 2 weeks kasabay ng cough po natin, which is yung febrile po yung isang tao or having or showing the symptoms of fever. Pain chest po, paninikip ng dibdib, loss of appetite. So, makikita natin yung mga tao na may tuberculosis na kilala natin na wala silang ganang kumain, they are lacking of energy, nanghihina sila. Kasi nga, hindi nila nakukuha yung nutrients na kailangan ng katawan kasi wala silang balak kumain or ayaw tanggapin ng body nila yung mga pagkain dahil sa sakit nila. So, this cause into the weight loss or malnourishment. So, pag meron po tayong problem na tuberculosis, need po natin palakasin yung katawan natin. We need to educate ourselves na we need to be stronger so we can fight it. So, for the next one po is the tuberculosis treatment in the Philippines and it will be explained by Ernest po.
So now let us proceed with the tuberculosis treatment in the Philippines. In our country, we have what call as DOTS or DOTS, meaning directly observed therapy short course. Ito po yung prescribed treatment ng World Health Organization para sa tuberculosis. Ito ay kino-consider na effective dahil ito yung nagbe-break ng cycle ng mismong sakit. Ang program na ito ay may mga components. Una, hindi isa or dalawang gamot yung kailangan para sa DOTS. There should be a combination. Some of the medication to be used ay rifampicin, isoniazid, niazide, pyrazinamide, and ethambutol. Ang pinaka-prescribed na combination ng medicine ay tinatawag na fixed dose combination o FDC. Next, there is a need na ma-isolate muna pansamantala yung tuberculosis patients. Ito ay about about 6 months. Mahalaga ito para mabawasan yung transmission or yung mga malalang cases. Component din ng DOTS ang observation sa patients while taking the medicine. Ang pinakamalagang components ng DOTS ay yung carefully na pag-observe sa patient ng health worker. Kaya ito tinawag na directly observed. Next slide. Let us proceed with its mandates provided by NTP regarding sa manual procedure nito. Again, based pa din ito sa guidelines sa provide ng WHO or World Health Organization. Una, yung mag-formulate ng iba't ibang policies, standard, and a national strategic plan. Pangalawa, yung pagmamanage ng logistics or it has something to do with the mobility and transportation ng transportation or the resources. Thirdly, yung decentralization or pagpapasa ng leadership from higher offices to smaller offices. Fourth, mahalaga din yung paggagamit ng information and data para sa mga activities sa program. And lastly, hindi pwedeng mawala ang monitoring and evaluation. Next slide. These are the vision, long-term goal, and medium-term goal ng National Tuberculosis Control Program. The vision is 0 cases, 0 deaths, and 0 sufferings from tuberculosis for the long-term goal. May specific percentage na target ang program which is reducing the TB burden by decreasing TB mortality by 95% and TB incidence by 90%. Lastly, sa medium-term goal naman, it is to reduce TB burden by decreasing the number of TB deaths. Kahit 50% lang nito, like 22,000 to 11,000, marireduce to 11,000. And also yung pagbawas ng cases by 15%. So we can see here na may particular goals talaga na ang program na ito. And it starts from the micro efforts that create macro impacts. Next slide. These are the specific objectives updated this year, 2022. Magagamit ng effective and efficient yung prevention programs para sa mga patients. Second, mababawasan man lang yung gastos ng mga tao sa sakit na ito. Third, there is also a need for sufficient manpower for this program to succeed. So human resources, they are all the health workers. Fourth, next yung paggamit ng data for the purpose of tuberculosis elimination efforts pa din. And fifth, ma-enhance daw yung kwalidad ng mismong prevention or treatment processes. Sixth, mas mag-expand pa yung mga dagdag na facility for this program up to 90%. Seven, ma-improve yung political stewardship or yung roles ng government natin, both local and national, in carrying out this program. Ito ay para mapabilis at mas epektibo yung program. If we can get adequate help from our government through their political efforts, mag-run smoothly ang program na ito. Next slide. Lastly, or the last slide, we have the persons involved in pursuit of this tuberculosis prevention program and TB awareness. First, the World Organization or the World Vision of the World Organization of the Philippines, it to bring awareness by fighting the stigma na related sa tuberculosis. So they help the communities na highly affected ng discrimination from the disease. They aim for educating other people about it. Secondly, we have the TB People Philippines Organization. This is a non-government organization. So this program is composed of the previous survivors of tuberculosis. This is beneficial for empowerment para sa mga current patients ng TB. Lastly, we have the Philippine Coalition Against Tuberculosis or the PhilCat. They have the important roles in making efforts from both private and public sectors para makatulong sa pagsugpo ng tuberculosis. They are also beneficial kasi nagkaroon ng cooperation dito yung private and public sectors. So all in all, nakita natin kung paano kumilos ang Department of Health alongside with other government, public and private organization para sa pagsugpo ng tuberculosis. And also, to bring awareness na din sa mga communities. The National Tuberculosis Program is a helpful way para mag-take control tayo sa sakit na ito. And mga healthcare workers. And there is a need to exert the best efforts para sa ating communities. We already have policies, visions, goals, and objectives. What we need is to implement and execute this effectively para ikakasucceed ng program na ito. Thank you.
So, ayun na nga po. So, for the conclusion, for this subject, the community health nursing, so this program aims to inform because knowledge will be the key in preventing and stopping the tuberculosis problem in our country. And the National Tuberculosis Program also wants to promote po the health and quality of life in our community. They want to prevent and control and eventually eliminate the tuberculosis problem. So, there are some ways na pwede tayo maging involved yung community natin sa program na ito. For example, webinars, Alam naman natin na we are going into technology right now. Alam naman natin may mga Wi-Fi tayo. So through webinars, may mga pwede tayong salihan na ganon para matutunan natin kung paano mag-prevent, stop, or cure yung tuberculosis. When it comes to community rin, meron ding mga online assistance yung DOH. Pwede tayong magpa-check up through websites. May mga ganong project po. And also, involvement and communication po. And for the conclusion, though diagnosed in clinics and hospitals, tuberculosis thrives in the community. Action in the community, therefore, is essential in country efforts against TB. So, nag-uumpisa ang prevention sa community natin. Pwede nating maiwasan tong problem na to basta mag-uumpisa po sa atin. It is also important to link community action on tuberculosis work on national tuberculosis program so that the efforts of the health system in our country are extended and will reach as many people as possible. So that concludes our sharing of knowledge in the National Tuberculosis Program. So, thank you, everyone.